Antidiuretic hormone is the hormone that is produced by one of the groups of neurosecretory cells that we have in hypothalamus. And after production of ADH, these cells pack antidiuretic hormone in their axon terminals. And as you see, the axon terminals of these cells would be located in posterior pituitary. As soon as hypothalamus detects that blood volume is low or blood pressure is low, basically, or even when hypothalamus detects a decrease in cerebrospinal fluid, which is an indication that blood pressure is low, quickly the order will be sent that ADH molecules should be released into the blood capillaries that we have in posterior pituitary. So production of antidiuretic hormone happens by the cells that we have in hypothalamus. However, the secretion of this hormone into blood occurs in the posterior pituitary gland. When we follow antidiuretic hormone in bloodstream, and keep in mind that the goal of antidiuretic hormone should be increasing blood pressure because it is released when blood pressure is low, and this hormone is involved in a negative feedback system. So following that goal, we see that antidiuretic hormone causes vasoconstriction of especially the arterioles that we have in abdominal viscera and skin to increase systemic vascular resistance and as a result increase the blood pressure. Another impact of antidiuretic hormone would be when it gets inside our kidneys and make nephrons that we have in kidneys to send more water molecules back into blood. So we can say that ADH makes nephrons to produce a lower volume of urine in order to increase the blood volume and increase the blood pressure. And when we go deep inside the kidneys and focus on the structure of nephron to see exactly which part of nephron has receptor for ADH impact those sections, we notice that the cells that line late distal convoluted tubule and collecting duct are the ones that will be impacted by ADH. As soon as the cells that line late distal convoluted tubule and collecting duct receive antidiuretic hormone, they increase reabsorption of water molecules. They increase pushing water molecules back into bloodstream to increase the blood volume. And clearly, when water molecules leave the tubule, it simply means less water is left in tubule to be eliminated in the form of urine. That's why we say urine volume decreases. After this short summary of release of ADH and its impact, it's important to note that there are several other stimuli for increasing the secretion of antidiuretic hormone. For example, pain when we're experiencing stress or anxiety, or when we are under the influence of medications such as morphine or some anesthetics. All these are different stimuli that increase production and secretion of antidiuretic hormone into bloodstream. And please keep in mind, when the level of ADH in blood increases, that simply means kidneys produce less volume of urine, and that helps keeping the blood pressure elevated. And we know that when blood pressure is within that acceptable range, that simply means blood flow is going to happen fast enough. However, there are some other substances that we consume them sometimes on a daily basis that they inhibit, they suppress secretion of ADH. A well-known one would be alcohol. Alcohol, tea, coffee, soda are examples of substances that they decrease production and secretion of ADH. So when we consume these substances, the blood level of ADH decreases. And please note that when kidneys are not receiving that much ADH, what they do, they keep eliminating water. Basically, the urine volume increases. Our body is losing water, and if we don't act, we end up being in a situation that is described as dehydration. So moderation is the key, but if it happens that we consume a little bit more than what we're supposed to of any of these substances, or in general, after consumption of the substances that inhibit secretion of ADH, considering that we know we're losing more water from our body, it is important that we replace the lost water by drinking the actual water.